What's up, guys? This is Jay from COI. So, the stimulus package did, in fact, pass. It passed almost like 20 minutes after I uploaded the video last night. And so, it was a compromise. Some of what I said did actually go into the bill, but a lot of good things went into the bill. So, I definitely want to make that clear. The important thing to note right now is that bill is not passed. Right now, it's being hung up by Lindsey Graham. If you couldn't tell by some of the images I decided to show, Lindsey Graham is a piece of garbage. And, if you're Republican or if you're Democrat or Libertarian, whatever, just enjoy the fact that Lindsey Graham is a piece of shit. Um, he is basically saying, him and Bernie Sanders got into a debate on the Senate floor tonight over him stalling on this plan. And the hang up for him was that, well, a lot of Americans, this $1,200 check is more than they make in a month. They shouldn't get that. He didn't take the time, as Bernie Sanders did, to say, look, economists and analysts and professionals in of our financial markets are saying this $1,200 is not enough. Lindsey Graham didn't say, as again Bernie said, that's a problem that these workers are making less than that. They are working 40 hours a week and making less than poverty wages. No, no. His whole take is you don't deserve that kind of money. That's his take. And we could go back and forth on the fact that Boeing still got their 50 billion, and going further into Boeing, we want to talk about who deserves stuff, who doesn't. A third of Boeing's earnings are from the government. I mean, they're the biggest welfare corporation I've ever heard of. But no, or we could talk about Raytheon or any of the defense contractors that Lindsey Graham totally gets behind. He has no problem throwing taxpayer money at giant corporations like that, and ones that, you know, go into endless wars that kill Americans and that cost us trillions of dollars. That's fine, but you don't deserve $1,200 a month. You're not worth it. We'll take your tax money, 100%, and we'll reallocate that, but we're not. You don't make up for it. But so anyway, when this does pass, and Bernie said tonight, and I talked to someone in Bernie's campaign who has been talking to him about this. They're pretty much positive that it's going to pass tonight. But when it does pass, I want you to be mindful that they're going to talk about how great of a job they all did. They're going to be patting themselves on the back and we saved you. You were fucked and we saved you. No. Understand that about $600 billion of this $2 trillion bill is actually going to help you. And not even all of you, sadly. But yeah, so less than half is going to directly affect most of you. The Corona check, as everyone's calling it, that accounts for about $250 billion. There is a really good aspect of this bill. It's about a $350 billion expansion of unemployment, and that allows for people who are on unemployment to receive an additional $600 a week. And this extends it for 4 months. I think this is fantastic, by the way. This is a great move. But that's it. The other stuff in this doesn't really help you. And remember, yesterday we were just talking about a $1.6 trillion bill, or, trillion dollar legislation that could give every American about 3 months of about $2,400 a month. Which at this moment it seems the smarter thing. It really does. And I'm going to go into how this affects the market, and we're going to kind of talk about the Trump's big concern. But I do just want to say this one thing. I don't know all the details of the stimulus package. I've just seen where certain money is allocated. One thing to also take note, the hospitals are going to get about $100 billion, which is pretty good, right? The giant slush fund for giant corporations is 500 billion. So yeah. And by the way, they are talking about that there is going to be some oversight on it. Then I've also heard there's not going to be oversight. So again, we don't really know all the details of it, but that's what's going on right now. And Lindsey Graham is kind of the douchebag of the moment. Um, and so the other thing we want to talk about is Donald Trump. Donald Trump says he wants the country to reopen by Easter Sunday. He wants packed churches. I had a whole slideshow set up, and for some reason it's not working. It must be uh, self quarantining itself. Anyway, Trump has this 2 week timetable when he says he's going to reopen America. We're going to be back open for business. Uh, that's just stupid. It's just a dumb idea. And I'll tell you what, because right now, they say in 2 to 3 weeks, New York is going to be at the peak. They are going to be getting just the most amount of cases they've seen. The hospitals are going to be overburdened, and it's going to be kind of the epitaph of the situation in New York. Now, I live in Kansas where we're not a hub. We're barely a flyover state. Nobody wants to be in Kansas. Our numbers are going up too. And I've heard Dr. Fauci talk about how, well, New York's, it's because it blew up before anyone realized it. Washington was the same way, but we can contain it. But I beg Dr. Fauci to look at New Orleans right now. New Orleans blew up that 2 weeks ago or 1 week ago. They had 100 cases. Now they're over 1,000. Why? I mean, it's not Mardi Gras. New Orleans is cool, but it's not a major hub. Kansas, there again. A week and a half ago, we had like, I think it was 4 cases, 4 to 7 cases. We're almost at the 100. We've we've had actual we've had a few deaths, which is nothing compared to the other parts of the country. But the fact that it's happening everywhere, and I've seen the model, and you can look it up before. I actually had it up here, but I don't. Again, it's not working. The model of the spread of this virus if we do nothing, and it's not pretty. It's not pretty at all. And just to go back to this, the story about the stimulus package. So, and what's more important? And let me, rhetorically think to yourself, what business got done yesterday? What was so big that happened in the stock market? Uh, you're going to say nothing. It's the same thing. We've been on lockdown, quote unquote. Everything's been the same. You're right. But the stock market yesterday had the biggest day that it's had since 2008, like right before the stock market crashed. Why? It wasn't because people were going back to work. It wasn't because industries were thriving again. No, it's because they thought they were going to pass the stimulus package. And let me ask you, as an average person, maybe you're quarantined, maybe you're not. If you're not, and you're out working, did you notice a difference yesterday? Did you get any more money? Did business change? No, you didn't. Nothing changed. It was the same. It's been the same for all the service workers who've been out there this entire time. It really hasn't changed anything. And so Donald Trump's a moron, and I look. I'm not even gonna spend much more time on this. I'm just kind of letting it be known because I guarantee you in a week or so he's going to go back on it and say, no, I never said it. Blah, blah, blah. No one's going to call him on his shit. And it's going to be the same thing. And who knows? He flip flops so much. I'm honestly scared going in. Like, if we make it through coronavirus, the next president is going to kill us because we're fucked. Biden is completely delusional and Trump is clueless. It's two old men who are just confused. Anyway, the last story I have is a really sad story coming out of Italy. There was a nurse in Italy in Lombardy actually, who was diagnosed with the coronavirus. And instead of going to work, because she knew she was going to be forced to go back to work, all nurses and doctors have got to work. They've got to help with the overburden of patients in their hospitals. Instead, she committed suicide. Um, really, it's it's a weird situation, and I'm really curious what your guys' thoughts on that. Like, do you agree with what she did? Do you think that she was selfless and this was something she did for her patients, or do you think, God, that's dumb. Why didn't she just walk away? Like she could have just left, probably. Well, who knows? They're in some really weird lockdown protocols over there, and I've heard that nurses and doctors are basically like working in the gulags over there. It doesn't matter what's wrong with you, you have to work. Um, so yeah, I'm really curious about your thoughts on that story. I find it sad, and I'm torn how to feel because in America, where again, in not even just America, but in Kansas, where most people are just walking around with their thumb up their ass and licking, you know, phone poles, not even worried about the coronavirus. I don't know how many times I hear in my town, this is all a hoax. It's just like the flu. Because, yeah, every year we have the flu, we need this many ventilators. And by the way, this many people are just spiking with disease during the flu season. It happens all the time, right, guys? Yeah, like we're always worried about running out of supplies during flu season. Hospitals are always filling up too fast. Anyway, yeah, for me it's easy to say. I don't. I'm conflicted on this. It's so final to just kill yourself, and you're not helping anyone, but I guess you're not harming anyone either. There's definitely two different ways to look at it. I also did want to say that some of the slides in here, just to give you an idea, are from the hospital that she worked, so you can see the number of people. But there's also a couple in here that are from the hospitals in New York, just to show you that it's getting bad in New York too. And this might not a nurse killing herself, but that level of panic and loss, I think, is potentially going to happen to us very soon. I hope not, but it's there. The potential is there. But more on her. I'm also curious. Again, do you agree or disagree? Do you think? Look, I disagree with what she did, but there's a good chance that she was so overworked, she hadn't slept. You know how your brain won't focus. Just if you've had a couple nights of getting like just an hour or two of sleep, and you have like that weird kind of cloudy judgment about you. Not to mention, she most likely had been on the bad side of losing a patient at least 4 or 5 times in her last shift and had to tell people, hey, sorry, you're gonna die, but we have to take this ventilator because there's a younger patient who will probably make it out better than you. you know those kind of things all start to add up in this kind of situation, and you're curious how much of that, how much of just like the trauma of the situation had to do with her deciding to take her own life, or was it this moment of clarity where she was like, look, no matter what I do, someone's going to have to die and it might as well be me. I don't know, it's a very interesting situation. Anyway, really really curious to hear your thoughts on this last story. um I appreciate you guys, everyone who um, leaves any comments, likes or dislikes, subscribes. I appreciate you guys. I hope you really are all staying safe. Everyone is staying at home if they can. If not, I hope you're being careful out there. Anyway, take care, guys. Talk to you tomorrow.